Here in the U.S., New York City has been the epicenter for COVID-19. Doctors from other parts of the country have jumped in to help at hospitals that are overwhelmed with patients.
And tonight, a local doctor who was there describes what it was like. Eyewitness News reporter Caroline Goggin has the story that's new tonight.
3 Rhode Island emergency medicine doctors are currently in New York City to help with the coronavirus response there. One of them is Dr. Wood Fisher, an ER doctor here at Rhode Island Hospital. During an interview Friday night, he painted a pretty grim picture of what it's like just about 200 miles south of here.
I've seen sort of little slices of things like this. I mean, there have been days when we're completely overwhelmed and you're really not sure where you're going to put the next person. But this is not a slice. This is the whole pie and a whole lot more.
Tragedy is unfolding in New York City, the epicenter of the coronavirus outbreak here in the United States. For Dr. Wood Fisher, an ER doctor at Rhode Island Hospital, it's the place he grew up. Now, years later, it's the community he's vowed to serve.
There are patients who are doing okay but are too sick to go home. There's patients on pressure masks, and there's patients who are intubated, who are incredibly sick and on the brink of death all the time. And some of them are quite young.
Dr. Fisher has worked in Rhode Island for the past 10 years, but earlier this week, he made the trip to New York City to work in the emergency room at a hard-hit hospital in Queens. He says there is a huge contrast between the empty city streets and the packed hospitals.
There's no trauma bay anymore because it's full of ventilated people. So every sort of graphic surgical procedure that we do is done, wherever there's a space in the hallway. So there are lay people seeing things they never, ever should see. And we can only imagine the sort of psychic trauma that we're inflicting on these people if they live.
Dr. Fisher says COVID-19 doesn't discriminate based on age or health. He says of the hundreds of people who have been intubated at his hospital in Queens, less than 10 have gotten off. After a week of work in New York, Dr. Fisher shares a message for us in Rhode Island, stressing the importance of social distancing during this time.
The one thing I would say to people in Rhode Island is if you give yourself a lot of false reassurances by saying, hey, other people have to change the way they behave, I don't. That may feel good for a minute or two. It may make your life easier for the next 10, 15 minutes, but it is the wrong move. And if you go light on science and a little too heavy on vindictiveness, you're going to make bad decisions.
Dr. Fisher also told me he believes we will all know someone this disease kills within the next year. Reporting in Providence, I'm Caroline Goggin, Eyewitness News.